Hello, hello, everyone. Good morning, good afternoon, good evening to wherever you are. Welcome to the next episode of the Public Health Gems podcast. We are looking forward to this really great conversation today with whether you're a friend, a colleague, a Sora of mine too, which is very special. And we're just looking to dive into this conversation because it has so much serious connected to it. It's so relevant for what we are hearing with our times. Let me backtrack to say, we are here for the Public Health Gems podcast. And what we do here with our conversations is that we talk about where we work, where we live, where we play, all these different factors around those things. And how can we have better health for our communities? How can we advance health? And like today and many days, you'll hear a lot of this information weaved in about Black maternal and infant health. So my name is Christine Ivory. I am your podcast host. I'm a public health professional. I am a project manager by trade, and I have deep connected roots to the maternal child health scene. So you'll always see me talking, writing, really just being with thought leaders around this topic. And that's why I am so glad that we have Trashaun with us today. So speaking of Trashaun, we're going to introduce our special guest. Happy to have her on today. As I was just mentioning, I'm so happy to have her time because I know she is a busy bee. But let's get into a short description of who she is, and then we're going to talk about the importance of today, and then go into some questions. So Trashaun Powell, she is the Vice President of Programs at the New Jersey Family Planning League. And she is a leader in human and fundamental rights and having over 2 decades of experience in state, government, and nonprofit organizations. Through her near-death pregnancy experience, she has been a long-standing advocate for equitable and quality maternal health for birthing people of color nationwide. And Trashaun, she, as I mentioned, she is the VP of Programs at the New Jersey Family Planning League, which is a nonprofit organization that is committed to providing access to quality, reproductive, and sexual health services for residents of New Jersey who need them regardless of their identity, income, and insurance status. So we welcome Trashaun to the podcast today. And before she goes into the questions that we have, and we just have so many thoughts that we want to share and get out today, but we just want to recognize that we know in the United States, that Black women are 3 to 4 times more likely to die from pregnancy-related complications. And in the state of New Jersey, so if we can hit a little bit closer to home in New Jersey, we know that Black women are over 7 times more likely to die from pregnancy-related complications compared to their white counterparts. And since we're talking about Johns, our Johns in Philadelphia, that 3 to 4 from the nation really mirrors over to Philadelphia as well, as we think about Black mothers and birthing people being about 4 times more likely to pass away from these complications. So we know that when we think about Black maternal health, we know it's at a state of crisis, and preeclampsia, which we'll talk about throughout our episode today, is a hypertensive disorder. So hypertensive, we're thinking high blood pressure, right? And that impacts mothers, birthing people, folks that are pregnant and after giving birth. And it's one of the leading causes of death among birthing people. So I want to stop there. We'll get into some of the disparities around preeclampsia as well. So I don't want to give too much away. But let me turn it over to our wonderful guest, Trashaun, and she's going to just lead us with some really great conversation. And our first question for her is, you tell us about your background with family health. We heard a lot in your bio. We just want to hear a little bit more of how you got to where you are right now. And how does this experience transfer in your role to, Vice President of Programs at the New Jersey Family Planning League?
Well, thank you so much, Sor Christine, for the invitation. I am so humble and honored to be in this space with you all and sharing a little bit of my story and my experience with Black maternal health and also with preeclampsia and HELLP syndrome. And so for me, it all started back in 2013 when I was pregnant with my first child. I developed HELLP syndrome at 23 weeks pregnant. I did not know what HELLP syndrome was. I knew about preeclampsia, but not what happens after preeclampsia. And so it's preeclampsia. And then if preeclampsia goes untreated, then you will have HELLP syndrome, which is also a hypertensive disorder of pregnancy, but HELLP syndrome, which is HELLP, which stands for hemolysis, elevated liver, and low platelet counts. And so what that does, that disorder starts to really attack your liver enzymes and attack your blood platelets. And so that happened for me at 23 weeks. And unfortunately, my daughter Mia had to be born at 23 weeks. She weighed 1 pound, 1 ounce at birth, and 2 days later, she transitioned. And so that is what really started my journey into maternal health, into like the importance of maternal health, because of that experience. And so that happened to me about 10 years ago. I still was working in state government with domestic and sexual violence and just continuing that work. But there was something since that time that was pulling at me, that wanted to be more in the space, that wanted to share my story more, that wanted to talk about what preparing your body does for pregnancy, what happens postpartum in pregnancy. And then 2020 happened. We all were home, COVID, and, you get that epiphany at that time, is that what was pulling me for about 7 years is something to, at that moment, was like, you have to do something. I wanted to change careers. And it wasn't scary for me because this is a space that I felt home, right? After that experience happened to me, there was nothing that I wanted to do but to be in this space with other advocates, sharing my story, looking into research, connecting with providers, speaking with community levels, at all community levels. And so when the opportunity came for me to join the New Jersey Family Planning League, it was God given. And so I'm so happy to be there. I am the vice president of programs. And so what that does is that position manages all of the FQHCs and hospital-based standalone family planning agencies and some of the Planned Parenthood affiliates across the state to really provide contraceptive access to those who need them, regardless of identity, insurance, and income.
Wow. Thank you for sharing your story. And I just want to go backwards to say thank you for sharing your story. Like, I know I just said it, but it just speaks volumes. And I know we'll talk about that storytelling component in a moment too with some of our following questions. But just having the amount of courageousness, the amount of just willingness to help other Black moms and birthing people out there, is so big, and it just cannot be discounted or put to the side. So we appreciate that piece, and so thankful that you're in the space where you are, because that work and what your experience, it really led you to the work, it sounds like, to what you do now. So really excited to hear more about your story and those pieces that will align as we get further into our conversation. But this is another question that I think will really be a great segue. So we know that storytelling and the voices of Black mothers and birthing people speak volumes, and they make change in public health. Can you share how you got involved in the Black maternal health space? How does your story and the voices and experiences of parents progress change? I saw recently, and it was like a day or two ago, your post from CDC with the Hear Her campaign. From CDC. It is a huge, massive campaign around preventing maternal mortality and maternal deaths. And so Trashaun, she shared her story there, which I know that she'll share more about that. And that shares a space with different athletes like Allison Felix and other women all over that are sharing their stories. So just want to talk about the impact of sharing stories and what that means to you. And also, how does this sharing of the story create change?
The sharing of the story for me was personal. When I was pregnant in 2013, it was a few of us. It was me and about 5 of my friends. And at that time, we had all recently gotten married. It was like, this is what's supposed to happen next, right? You meet the great guy, you get married, you sail off to France, and then you come back and you have a baby, right? So everything was happening in the way I thought it was supposed to happen. We took contraceptive counseling. We knew when it was time to get off birth control. And all of our friends, one was popping up pregnant, the next one was popping up pregnant. It was 5 of us. So we were all sharing our stories about how it was being in our first trimester, who was sick, who wasn't, being in our second trimester, who gained weight, who didn't. But I never made it to that 3rd trimester. And out of my 5 friends, it was me who had preeclampsia. It was me who had HELLP syndrome. it was me whose child was born early and child died. And so as we shared everything, everything stopped being shared at that moment. And I was afraid to go around my friends. They were afraid to kind of have me around because it was kind of like I walked around with a dark cloud of the person whose child has died, right? And there's nothing happy about that. There's no rainbows or sunshine about that. It's just darkness. And we shared everything. We shared stories and we stopped sharing stories. And so I kind of wondered, is like, why couldn't I share my story then? And as a friend, I was saying, is it wrong of me to want to share my story while they're pregnant? Is it wrong of me not to want to share anything now because this ultimate trauma happened to me? And, I kind of like was walking around as like death's doom. And so in healing, I felt free when I started to share what happened to me. I felt free when I learned that preeclampsia impacts Black women at alarming rates than it does white women. I started to feel free when I saw that there were other Black women that I met in this space that this has happened to as well. And we weren't sharing. We weren't sitting at the table telling what happened to us. We were just dealing with it and going, putting a red lip on and facing the next day. And I didn't want to do that. I felt that Mia's life had impact. I felt like I changed after Mia and I wanted the world to know. And so I didn't set out to be this national person to share my story. It was just me sharing with a few of my friends. That's how it started. After that, I started to speak out at the Preeclampsia Foundation signature event, the Promise Walk, and I started to do community events. I started to share my story with the media. I started to share my story with the Star Ledger at that time. And so I continued to do that, and folks would come up to me and tell me, how me sharing my story gave them the hope to try again. Because after Mia passed, I had more kids. I have a 9-year-old. I now have a 5-year-old. And I was afraid to get pregnant the second time around. I didn't want to die. I started to feel a little safer when I had my son Ryan, but he also was in a NICU. He came early. And so pregnancy for me was not a walk in the park, but it's not a walk in the park for everybody. And I think that those things needs to be shared. And so that is really how I got into the space. That's really why I feel that our stories will make a change and make an impact if we continuously have the space such as this to really share what happened to us and to share what we've done and to also let other people know is that it's okay to share your experiences.
Mm-hmm. Yeah, that last word that you just said, it's okay to share. I think sometimes, or a lot of times rather, like in the Black community, if I could speak as a Black woman, I can't speak for all Black women. We're not a monolith, as we know. But we know that a lot of times that we could be siloed, feel like we're by ourselves, or like we're kind of carrying this burden alone, not even maybe even telling our partner, or not even telling, those that are close to us, and kind of holding on to that. So you saying that through the story sharing that you received that type of freedom, and then also educated people and saved lives. I truly believe that too, with people, being more knowledgeable about preeclampsia, the warning signs, all those things. You're just making those waves. And like you said, it might not have been the intention at the beginning, but once again, we just appreciate what you do and how you do. So thank you. So another question that we're thinking about, and our listeners, myself, we always say these words, which is tribe. So in Public Health Gems, we're always thinking about the importance of a tribe. These are who our partner is, our family, our friends, community, the neighbor, whoever, anyone that we would consider, tribe. And so what are some of those key takeaways that the tribe should know, or your support people should know around preeclampsia, and how can they best support birthing people that are going through issues of preeclampsia, whether it's like identifying those warning signs or, post, like you said with your story, like everything that happened. How can, Black moms be supported in this space?
Preeclampsia, it impacts everyone, right? And for me, I had HELLP syndrome again, which is the severest form of preeclampsia. But my husband also experienced it, right? He may not have had the physical that preeclampsia had to me, but he felt the residual impact. And so, as support people, as a tribe, as our community, as our sororities, and just folks who are surrounding our birthing people, preeclampsia is not just for the birthing person, it's for you too. And so, as a patient, I think it's important for our community, for our support person to know more about preeclampsia, to know more about other hypertensive disorders of pregnancy, and also understand that preeclampsia is not always deadly. However, it impacts Black women more than it impacts any other race. And so I'm sure everyone's heard the statistics. Black women are more likely to die in childbirth. Black women have poor birth outcomes. Black women have a greater risk for preeclampsia. We know those, right? But the issue is change. And it starts literally by including all of us and elevating the perspectives of Black moms in our research. And so the Preeclampsia Foundation, I'm just going to do a shameless plug here, preeclampsia.org/take10. And that is taking 10 minutes of your time as women of color to help us in research. Because currently, what research says right now is that preeclampsia impacts white women. And so we know that that's not true. But when we look at statistics and we look at what the research says, if our data is not there, the data cannot tell the story for us. And so it's very important for us to be able to provide our information, to be able, for research, to be able to provide better outcomes for us. We can't provide better outcomes if we're not there in the research. And so with that campaign, with the Take 10 campaign, it's literally sharing your story, sharing your data, so that it can change hers, so that it can change yours. And I'm a strong advocate is that change starts from within. We started with change in the civil rights movement. When we see it's an issue, we make noise about it. And that is what we're doing now to better birthing outcomes for people of color. Because when we talk about our birthing stories, when I have had Jasmine, my second daughter, I smile when I talk about when she was born and how I held her. It gives me joy. What I don't want to see is that us sharing our stories with pain and with trauma. And so in order for us to change that narrative, we all have to be a part of it. Not just patients, our communities, our providers, because again, change starts from within.
Absolutely. Yeah. I'm just digesting it and I'm taking all of that in, but you're so right. And I love how you said to never be afraid to make noise. When it's something that is happening to everyone, but for Black people disproportionately, what's the stat? It's 60% more prevalent for Black individuals to face preeclampsia, and we know the devastating issues and even death that can occur and follow. There has to be action. To be action based, we have to make some noise about it, right? So thank you so much. I think that really spans the surface for our tribe and our support people. But for those that are in the public health field listening in, that's a major gem. So thank you for dropping that. So I'm smiling about this next question. I am like still feeling the chills from that day. In spring 2023, you pioneered the first preeclampsia promise walk in Somerset, New Jersey. I'm so happy I was there that day. My ankle was a little jacked up, so I didn't get my walk on like I wanted to. But you invited me there as one of your guest speakers, and we just had a ball, and it was so great to see everyone convene, everyone to be so aligned and to be interested in just really making the change, as you just mentioned. So can you share the importance of gathering community and establishing those meaningful connections around Black maternal child health and preeclampsia? What does that mean to you?
It means a lot. For me, community is where I find joy. Community is where I find life. Community is where I find support. And that all started for me as a young girl. My mother is one of 12, she's number 10. And I just have always been surrounded by so many people, from church to now sororities and college life, and my husband and his big family. And so it all starts with community. When you want to do something, where does it start? In your community, right? And your community could be a plethora of things. It could be your church, right? Um, and so after everything happened with me in 2013 and losing Mia, I had found the Preeclampsia Foundation's signature event, the Promise Walk. And I was a part of the Promise Walk for 9 years. And every year that my family and I participated as Team Mia Jane, we never saw another Black or Brown family. And so that was puzzling to me, is that I found this walk. Why didn't anyone else find this walk? And so for years and years, I was wondering, how do we get this for my people? And again, 2020, you get the epiphany, right? And so I said, I want to do a walk for us. I want to do a walk that's a collective of people who look like me, right? Because we see the statistics, we know all of the news stories, we can share all the names, but why are we not pushing this for us? And so I prayed about it. I talked to my husband about it. I talked to a few of my friends about it. And I said, listen, I don't know how I'm going to do this. I don't know what resources I'm going to pull together, but I believe that it is my job to develop something for us. And so I set out. Mia would have been 10 years this year. And I said, this is the time. I don't know how it's going to happen. This is the time. And so just like I said earlier, I made noise. I talked to anyone walking about this. I shared my story to my community folks. I shared my story to my chapter members, to my husband's chapter members, and everyone knows how this is not something that I do, right? This is something who I am. After losing me, it changed the person who I am. And so every time I'm walking, I'm advocating for other people, right? For me, I'm advocating. And so I did not know that this would have happened, but we ended up having over 100 folks registered, over 100 folks in attendance, and we raised $12,500, being our very first walk to date. Team Mia Jane is the #1 fundraiser for preeclampsia research in the United States of America.
Wow.
That. And I'm so proud. I am so proud because it started off as, I'm not sure if I'm going to be able to do this. I'm not sure if anyone's going to be able to come out. And people came out and they showed up. And so that was the first. We're looking at doing it again next year, in Somerset Promise Walk. And I'm still reeling off of just raising that amount of money in a short amount of time. But just being so excited. So excited.
Same here. Those who are tuning in on YouTube, you see me cheesing throughout what Trashaun just mentioned to us. It was truly a beautiful day. The weather was perfect. Everything was right. But just thinking about all the hard work and determination and just the nonstop, like, I'm going to do this. I had my mind set. I saw the social media campaign. Like, trust me, like she was doing it, and we we appreciate it, because I'm gonna be there next year. My ankle will be all jacked up. I won't have, because I was gonna walk up there in my boot, but I know people are probably what's going on with her. But next year I'm gonna have my ankle together. I'm gonna be ready for the walk. I'll probably try to get a little jogging maybe or something.
Right.
But look, we're here to support it, and I know that as you continue to hold it and have this convening, I know it's just going to get bigger, larger, expansive. And like you said, it's going to research, it's going to awareness, and these are so many important places for that to pour into. So thank you for your work there. So we have another question for you. And we're beginning to wrap up already. Oh my gosh. Okay. So this question is, kind of including some of the pieces that we just talked about, your involvement with community and how that cross sections also with these really great organizations that are out there too. So can you share some of the initiatives that you belong to? Talk about your roles with the Preeclampsia Foundation, with mamas, with well, all these different spaces. But then if there are any resources or gems that you could drop around preeclampsia or Black maternal health that you want us to know, please let us know. And as a second, I have my loaded questions. What are some recommendations that you would share with public health professionals who want to advance Black maternal health? That's a big question, a meaty one, but anything that you want to share.
To advance Black maternal health starts by listening. It really does. It starts by elevating our voices, standing with us, right? Not standing in the gap for us, but standing with us to be able to elevate our voices to make the change that we want to see and that we all should want to see. I think it's incredibly important as Black maternal health professionals, if we are in the provider space, to treat the patient relationship as a relationship, right? It starts with trust. I always say, as a provider, if you treat this patient like a chart, you got the chart and you don't know who's on the other side of the door, that describes a relationship. One thing that I did love about the relationship that I had with my provider who birthed all of my children, Mia, Jasmine, and Ryan, was that he knew that my husband was a Tar Heel fan. He knew that my dad was a Giants fan. He knew that I wasn't giving up coffee even if I was pregnant. And so I love that I could be able to walk into his office and I not say anything because he saw the fear on my face and said to me, "You're going to be fine." And this was when I was pregnant with Jasmine. And so it really starts by developing that relationship for the patient and the provider. And for the patient, the same thing. When you are trying to get pregnant, or when you're at that moment where you are pregnant and you want to go to further the pregnancy, when you find a provider, it's just like a relationship. What do you seek from this relationship? Because that person, that provider, is really with you during the most memorable, most special times of your life. And so that relationship really means something. And so some of the organizations that I am a part of lends to that. And so Mama's Voices is a sister company which started out of the Preeclampsia Foundation as a patient advisory led coalition of all patients who have had preeclampsia. So there are a bunch of preeclampsia survivors who are utilizing their voices every single day to make change throughout the nation. In New Jersey, we have about 8 certified patient family partners, and you can find that at mamasvoices.org. On the Preeclampsia Foundation, I serve as the Patient Advisory Council. And what that does is that is also, we are advising patients, we are advising providers how they should interact with patients. And so again, this is not just me sharing my story, it's using my story to really impact the change that we all should want to see.
Right. That's right. Yeah. And as you can see, I'm like looking down, I'm like, I'm going to take my notes as Trashaun's talking. Okay. I hope that you're doing the same. But in the case that you are not taking the notes and you're driving along or whatever the case may be, exercising, that's all right. Because we have all of this. We will have all this in the show notes. So do look for that, for some of those great gems that Trashaun just gave to us and imparted to us today. One thing that I took from the top of what you just said and thinking about listening to Black mothers, to listen to birthing people, like you said, these relationships with the provider are so essential. Actually having the provider listen and treat us as a human being, not a number, not like a chart, like you mentioned. And for those birthing people that, feel like they are disrespected or feel like they have not been treated with dignity and respect, that you can have a second opinion, that you can go to another provider, and that's perfectly okay too. So just knowing our rights in the space, and knowing what we deserve, and being able to have the best, birthing and pregnancy experiences are so important. So thank you for that. So we are going to get ready to wrap it up. Trashaun, we are so thankful once again for you to come. to the Public Health Gems podcast and drop some gems on us. You're giving us some valuable information, some really wonderful insight for our birthing people, for our parents, and the Public Health Johns community. And so I want to know, if folks want to connect with you, where can the people find you?
Well, I've been working out lately, so you can find me on the Peloton leaderboard. But if you want to find me on social media, you can find me at Expecting Excellence on Instagram, YouTube, and Facebook. You can also find me on Twitter at Trashaun, and you can follow my personal story on Instagram at Mia Jane.
Excellent, excellent. Do follow. I know that I am, and I'm always, getting them gems, those gems, outside of our conversations that we have together. So thank you again for being here. Next up on the Public Health Gems, as I mentioned, we have a beautiful, wonderful season to go. So many great speakers, just like Trashaun, who will just be giving us and dropping those gems on us. So get ready for our next episode. And we're now into September. So we do have really exciting news to share. I mentioned this on our last podcast, but we're getting close to it. We will have our very first in-person event. It is our Public Health John launch party. It's called Networking Underneath the Stars. It's going to be on September 28th in Philadelphia. A nice little networking mixer. So get out your business cards, whether they're the traditional business cards or the virtual ones, whatever you like. And just get ready for a night of fun. We'll have open bar. We'll have some great snacks and refreshments. Just a great way to network with other individuals. So get ready for that and look for the details at publichealthjohn.com as well as at publichealthjohn on Instagram. So until next time, we look forward to seeing you. Feel free to give us some thoughts of what you thought about this episode, and if you want to share your experiences and let us know how that's been going for you as well. But until next time, we will see you on the next episode. Bye, everybody.